The global health community is currently monitoring a significant and unusual cluster of hantavirus infections, an event that has triggered international surveillance protocols and renewed scientific debate regarding the influence of environmental shifts on zoonotic disease patterns. On May 2, 2026, the World Health Organization received formal notification of a severe respiratory illness cluster originating on a cruise vessel, the MV Hondius, which had recently traversed ecologically sensitive regions of the South Atlantic. This outbreak, involving at least 8 cases and 3 confirmed deaths, has become a focal point for epidemiologists investigating how hantaviruses interact with changing climates. While hantaviruses are a known family of rodent-borne RNA viruses first identified in the late 1970s, the current trajectory of the disease suggests a potential expansion in its reach. In 2025 alone, the region of the Americas reported 229 cases with a case fatality rate of nearly 26%, underscoring the persistent lethality of the pathogen. Scientists are increasingly linking these fluctuations to what they term climate catastrophes, specifically the alteration of precipitation cycles and temperature gradients that dictate the population density of rodent reservoirs. These environmental changes can lead to masting events, where a sudden abundance of food sources causes a surge in rodent populations, subsequently increasing the probability of human exposure to viral shedding. +3 hantaviruses are typically categorized into 2 primary clinical manifestations based on their geographic and biological characteristics: Hantavirus Pulmonary Syndrome, or HPS, prevalent in the Americas, and hemorrhagic fever with renal syndrome, or HFRS, more common in Europe and Asia. The current outbreak is specifically linked to the Andes virus, a strain of hantavirus unique for its documented capability of limited person-to-person transmission. The MV Hondius departed from Ushuaia, Argentina, on April 1, 2026, traveling through remote territories including Antarctica, South Georgia, and St. Helena. Public health officials are now meticulously tracing the itinerary of the index case, who is believed to have acquired the infection through environmental exposure in Argentina prior to boarding. This incident serves as a critical case study in how global mobility and environmental instability can combine to move a traditionally localized pathogen into unexpected, confined settings. As global temperatures continue to exhibit an almost exponential influence on the physiological traits of disease vectors and reservoirs, health agencies are warning that the traditional hunting season for these viruses may no longer be confined to predictable seasonal windows, necessitating a more robust, year-round approach to biosurveillance and public health reporting. The operational response to the May 2026 hantavirus cluster involves a multi-agency coordination between the World Health Organization, the Centers for Disease Control and Prevention, and the National Institute for Communicable Diseases in South Africa. Laboratory investigations have been central to managing the crisis. On May 2, clinicians in South Africa confirmed hantavirus infection in a critically ill passenger who had been medically evacuated. By May 6, viral sequencing definitively identified the pathogen as the Andes virus. This identification is significant because, unlike the sin nombre virus common in North America, the Andes virus can spread through close, prolonged physical contact or exposure to respiratory secretions. The timeline of the outbreak shows that illness onsets occurred between April 6th and April 28th, with patients initially presenting with non-specific symptoms such as fever, muscle aches in the large muscle groups, and gastrointestinal distress. However, the clinical progression was rapid, frequently leading to acute respiratory distress syndrome and hypertension. The pathology of hantavirus is distinct. It does not typically cause direct destruction of cells. Instead, the virus triggers a dysregulation of the host's endothelial barrier, causing the vascular system to leak plasma into the lungs or kidneys. In the case of Hantavirus Pulmonary Syndrome, this results in a sudden, often fatal accumulation of fluid in the lungs, with the current outbreak reporting a case fatality ratio of approximately 38% among those with severe respiratory symptoms. +7 logistical challenges have complicated the international response. The CDC has deployed a specialized team of epidemiologists to the Canary Islands to meet the vessel and conduct individual risk assessments for passengers. Plans are currently underway for the medical repatriation of American citizens to the National Quarantine Center in Omaha, Nebraska, via specialized flights to Offutt Air Force Base. Simultaneously, the national IHR focal points in the United Kingdom, Argentina, and Chile are conducting contact tracing for individuals who disembarked at various ports of call, including St. Helena and Tristan da Cunha. Lab guidance issued by the NICD emphasizes that early diagnosis remains difficult, as the virus may not be detectable in body secretions during the first 72 hours of symptoms. Consequently, repeat diagnostic testing using both PCR and serology for IgM and IgG antibodies is often required. There remains a stark contrast between the confirmed data and the initial reports of the illness. While early rumours suggested a broader contagion, verified information currently limits the confirmed cases to a small cluster. Though the World Health Organization maintains that the risk to passengers and crew remains moderate. There is currently no widely approved targeted antiviral therapy or vaccine for hantavirus, making early supportive care in a facility equipped with a full intensive care unit the only viable intervention for improving survival rates. Prevention and long-term surveillance remain the primary tools for mitigating the threat posed by hantaviruses, especially as climate-driven shifts continue to alter rodent habitats. Public health guidance remains consistent. The most effective way to prevent infection is through integrated pest management and the elimination of rodent contact in both rural and domestic settings. This includes sealing entry points in buildings, using traps, and maintaining clean food storage areas. When cleaning areas where rodents may have nested, officials strongly advise against sweeping or vacuuming, which can aerosolize viral particles. Instead, surfaces should be thoroughly wetted with a disinfectant or a 10% bleach solution to deactivate the virus before it is wiped away. In the context of the recent cruise ship cluster, the CDC has reinforced that for the general public, the risk of infection remains extremely low and routine travel can continue as normal. However, for those in high-risk occupations, such as farmers, forestry workers, and construction personnel, the use of personal protective equipment, including gloves and high-efficiency particulate air masks, is recommended when working in potentially infested environments. The international community continues to work under the international health regulations to share data and align monitoring guidance across borders. +2. The limits of current medical knowledge regarding hantavirus are significant. While supportive care has improved, the high fatality rate of Hantavirus Pulmonary Syndrome persists due to the lack of a specific cure. Scientists are calling for increased investment in One Health surveillance, which monitors the health of wildlife and the environment alongside human populations to provide early warning of future outbreaks. Despite the intensity of the May 2026 event, officials emphasize a calm and measured approach, noting that hantavirus infections are relatively uncommon globally compared to other respiratory diseases. The ongoing investigation into the MV Hondius will provide critical data on how the virus behaves in enclosed environments and the efficacy of international quarantine measures. As researchers continue to analyze the links between climate instability and viral activity, the goal remains the development of a universal vaccine or more effective antiviral treatments. For now, transparency in reporting and rapid laboratory response remain the best defenses against a pathogen that continues to exploit the changing boundaries of the natural world. Stay informed on public health developments by following official agency updates. The operational response to the May 2026 hantavirus cluster has moved into a phase of intensive laboratory analysis and multinational coordination, centered on the specialized facilities of the National Institute for Communicable Diseases, or NICD, in South Africa, following the medical evacuation of the index case in early May. Laboratory technicians utilized high-throughput sequencing and reverse transcription polymerase chain reaction protocols to identify the specific viral strain responsible for the outbreak. By May 6, the NICD, in collaboration with the World Health Organization, confirmed that the pathogen was the Andes virus. This discovery is scientifically significant because the Andes virus, primarily found in South America, is the only hantavirus strain with documented evidence of limited person-to-person transmission. This specific characteristic has necessitated a shift in public health reporting from environmental exposure tracking to a more complex interpersonal contact tracing model. Clinical data from the treating physicians in Cape Town indicate that the patients exhibited a rapid progression of symptoms, moving from a febrile prodrome characterized by intense muscle aches and tentinal issues to the more lethal Hantavirus Pulmonary Syndrome within a span of 72 hours in the United States. The Centers for Disease Control and Prevention and the Department of Health and Human Services have mobilized the national disaster medical system to manage the potential arrival of exposed individuals. Logistics currently involve the repatriation of American citizens from the MV Hondius via specialized aeromedical biological containment systems. These flights are scheduled to transit through the Canary Islands, where a secondary screening station has been established to conduct initial serological testing. The CDC's Viral Special Pathogens branch is overseeing the laboratory requirements for these arrivals, noting that testing for hantavirus requires BSL-3 or BSL-4 containment levels when handling live cultures. Diagnostics rely heavily on the detection of IgM and IgG antibodies. However, officials warn that a negative result in the early stages of the illness does not definitively rule out infection, as the viral load may not reach detectable levels in the blood until several days after the onset of fever. This diagnostic lag remains a critical challenge for clinicians trying to triage passengers who may be in the incubation period, which can last anywhere from 1 to 8 weeks. The investigation into the vessel itself, the MV Hondius, focuses on both environmental and logistics angles. Epidemiologists are examining the ship's recent ports of call in Argentina and Chile to determine if the infection was acquired via rodent excreta in a land-based setting, or if a reservoir was present on the vessel. Shipping and trade officials have noted that while hantaviruses are not typically a concern in maritime logistics, the increasing range of rodent reservoirs, linked by researchers to the climate catastrophe mentioned in recent scientific briefs, means that traditional surveillance boundaries are shifting. Laboratory studies into these environmental links suggest that higher temperatures and erratic rainfall have altered the behavior of the long-tailed pygmy rice rat, the primary reservoir for the Andes virus. Verified data from the WHO indicates that the current case fatality rate in this specific cluster is holding at approximately 38%, a figure that highlights the extreme severity of the condition. While some early news reports suggested a wider contagion, health agencies have countered these claims with verified evidence that the cluster remains confined to individuals with a direct link to the specific voyage, emphasizing that there is currently no evidence of broader community-level transmission. The prevention of hantavirus infection relies on a rigorous combination of environmental management and personal protective measures, particularly as the traditional boundaries of rodent habitats shift due to the ongoing climate crisis. Public health officials emphasize that the most critical step in preventing the aerosolization of the virus is avoiding any cleaning methods that stir up dust, such as sweeping or vacuuming in areas with suspected rodent activity. Instead, the standard protocol involves the use of a 10% bleach solution or a commercial disinfectant to thoroughly saturate contaminated surfaces for at least 5 minutes before removal. This wet cleaning method is essential because hantaviruses are enveloped viruses, meaning their outer lipid layer is highly susceptible to common detergents and disinfectants. Yet the virus remains stable and infectious in dry rodent excreta for several days depending on ambient temperature and humidity. For property owners and those in rural settings, the CDC recommends a proactive seal-up, trap-up and clean-up strategy. This involves sealing entry points as small as 1/4 of an inch to prevent the intrusion of deer mice, white-footed mice, or the long-tailed pygmy rice rat, by eliminating nesting materials and securing food sources in rodent-proof containers. The domestic environment becomes significantly less hospitable to the primary reservoirs of the disease on a broader scale. Global health surveillance is transitioning toward a One Health framework, which integrates the monitoring of wildlife, environmental changes, and human clinical data to predict future surges in viral activity. Scientists monitoring the 2026 climate patterns have noted that as extreme weather events, such as unseasonable flooding followed by prolonged droughts, become more frequent, the ecological balance governing rodent populations is disrupted. These environmental stresses often lead to masting, where a sudden surplus of seeds and fruits triggers a population explosion among rodents, followed by a period of resource scarcity that forces these animals into closer proximity with human dwellings. Current surveillance programs are utilizing satellite imaging and ecological modeling to identify these high-risk periods in advance, allowing local health departments to issue targeted warnings to at-risk populations. However, the limits of current knowledge remain a significant hurdle. While we understand the mechanism of transmission, there is still no widely available vaccine for Hantavirus Pulmonary Syndrome, and clinical intervention is largely restricted to aggressive supportive care such as extracorporeal membrane oxygenation or ECMO. In specialized intensive care units, the ethical implications of managing these outbreaks also come to the forefront as international travel and trade routes continue to expand. Public health reporting must balance the need for transparent, rapid communication with